Hello, everyone. Welcome to episode 1. I would like to call this segment Define That. So, basically, today we're going to be talking about sprains, strains, dislocations, subluxations, and fractures. So, the reason I want to start with this, I feel like this is more of a basic concept of understanding when you go to the doctor, if you get injured. Um, so, what happens is protocol for like where I work is you get injured. I say, okay, I believe this is an injury that you need to go to the doctor for. You go to the doctor, whoever the hospital is. They'll you go to the doctor. They'll do an X-ray. They'll do whatever evaluation they need to do, and then they'll print you out a paper that basically tells me the treatment or the diagnosis, and I'll read it. So basically, it's not going to say, "Oh, Johnny broke his left leg and he did whatever." It's gonna say Johnny fractured his tibia. It's gonna give me the specifics. So what I like to do is I want you guys to understand what some of these words that you might find if you ever look at your own doctor's report, or if you look at somebody else's when you become in the field, or for like my athletic training students. Sometimes we're able to share that with you guys, and if the athlete allows it, obviously there's HIPAA laws and things like that. So we're going to start with what I find very common. I'm going to say basic, or most common injury, and that is going to be the two. There actually are two of them. The most common injury I want to start with are sprains. So sprains, Sprain, is different than a strain, which is Strain. I'm not saying that because people don't know how to spell. I'm saying that because sometimes when people talk fast or from the South, that's just me, sometimes you might understand, or they're from somewhere else, you might understand it. So a sprain is a injury to a ligament. A strain is an injury to the muscle. So somebody might be like, I don't know what a ligament is. Hold on, I got you, I promise. So a mm, so a ligament is a piece of connective tissue that connects bone to bone. So usually you'll find a sprain in a joint. So my wrist is a joint. My fingers are joints. They bend. My thumb has a joint in it. My hip, my knee, my ankle. So that's usually where you will find a ligament sprain. Easy to That's just kind of what I use as a guide to kind of help people out. So the second thing that you will find is a strain. So that is a muscle. So people know like muscles are connected to ligaments, muscles are connected to bones, muscles are found throughout muscles are pretty most people understand what a muscle is. How it allows you to move and do things that you need to do in your body. But most of the time muscle strains are found not in joints. So you usually find them in like the arm, or you might find them in the quad, or the hamstring, or the calf. So that's usually where you will see muscle strain, sometimes in the back, because those muscles are a lot smaller. So the big thing I want people to understand about muscle strains and sprains, they are categorized the same way. So we have grade 1, we have grade 2, and we have grade 3. So grade 1 is the most minor. So that means that there's a pull. So the ligament got stretched, the muscle got stretched, but it did not tear. Those are usually the people like, oh, I'm injured. Oh, it hurts. It might be very little swelling. That's usually kind of what it looks like. And that doesn't mean that people aren't in pain. Everybody has their own pain thresholds. But when you go to the doctor, a sprain means that there are no tears. So a grade 2 strain or sprain means that there's a partial tear. So it's a partial tear to either a muscle. So if it is a grade 2 strain, it will be a muscle that is partially torn. If you hear about a grade 2 sprain, that usually means that a ligament is partially torn. So there's just keep it that simple. Grade 3, which is not as common, but it happens, and these are pretty kind of like oof, is a complete tear. That means that if you find a grade 3 strain, that means that there's no muscle holding on to itself. So the muscle has completely ripped. It's just loose. A grade 3 sprain, same thing with the ligament. It's gone. It's not attached to itself anymore. So we're going to start those. Recap. So we have sprains, which is where the ligament is injured and that the ligament connects a bone to another bone. Then you have a muscle strain, which is where you will find just muscle and injuries that are found within the muscle. So we also have grades. So not only did I went to the doctor and have a sprain, or I went to the doctor and have a strain, the next follow-up question is what grade? So grade 1 is the low level. That means that there is a pull. That means that there is stretch, but there is no tear. Usually quickest recovery. Grade 2, partial tear, just depending on where it's at, determines, injury recovery time. Then you have grade 3, which is a complete tear, which needs surgery guaranteed. And those are just, there's nothing connected to itself. It's gone. So now we're going to talk about dislocations. So dislocations are found within joints. So basically, a dislocation means that whatever joint it is, and I'm just going to use the shoulder joint as an example. So actually, I need my hands for this. We're going to clip onto this. So in the shoulder joint, you will have an injury where I don't want to get into the joints too much. That's a different video. But so you have a ball and socket joint. So this is your shoulder. So I'm really going to take it from here. Shoulder here. Humerus is going to be this. So in a normal shoulder, it fits like this. I can move my shoulder up, back, all the different things. It moves like it's supposed to. In a dislocation, you'll have it is moved out of the joint. So it could be moved forward, it can move backwards, it could move where it's not supposed to be. So when you have somebody with dislocation, that means that you'll see it. You'll come up to them, and when you look at that shoulder, it is not in place. The humerus, so the whatever bone will be, it's not moving smoothly. If you don't know if it's dislocated, always go to the non-injured side. So when you see somebody's shoulder, it kind of looks like it, but people got to understand normal is relative. So always look at the opposite side. Thank God we have two extremities. So if you see it if you see it on the shoulder, on the right shoulder, on the left shoulder, then look at the right shoulder, compare it. That's going to give you the best understanding. So if they look very similar, okay, it might not be. But if it looks completely different, then you know it is. So dislocations, you will find finger dislocations, you will find shoulder dislocations, you can find elbow dislocations. Anything that looks like it's not supposed to be there or the bones aren't smooth, then you'll see that as a dislocation. I don't really like to get too much into dislocations for non-professionals because leave it to the professionals. If it's dislocated, one or two things: go to the doctor immediately, go to the ER, go to urgent care, depending on where you are and what you have access to. And if there is a certified athletic trainer, if there is certified EMS, if there's somebody who is certified and knows what they're doing, not just a random person who's watched Grey's Anatomy and knows what they're doing, they are, depending on their qualifications, some people are qualified to relocate. Some people can technically relocate, but they choose not to because it gets a little dangerous. If the wrong person relocates it, they can injure and break the bone. They can cause other problems. If they're not doing what they're supposed to, relocating it the wrong way will cause more problems than leaving it alone. So if you are not qualified, leave it alone. If the person that comes up to you and you ask them, hey, are you qualified? Are you a nurse? Are you qualified? Because sometimes people are you qualified to do this? My rule is, as an athletic trainer, if I can't get it in the second attempt, I stop. Sometimes I give it 3 times. If it's in a situation where I know it's on my hand slipped or I believe I can get it, I got really close, that's pushing it. 9 out of 10 times, 1 and 2, I'm done. I'm not going to do it again. I'm putting the patient more at risk. I'm obviously not getting the right angle. I'm not getting the right, it's just not working. I'm not going to force it. So number one, if you see somebody dislocation, number one, you want to get them to some medical care ASAP. That's number one. So, since we're in the category of dislocations, we're going to go to subluxations. So, these are, I don't even want to call them not common because I think that they happen, but most people don't even know what they are. So, a sublux is if I were to, if my knee, like my patella, was to pop out of place. And so I like, ouch, ouch, something's wrong. Something doesn't feel right. My kneecap moved out of its way, and then I move like straighten my knee back out and it goes back into place. So the time that I get to a medical professional, sometimes even as an athletic trainer, I've gotten to the court, I've gotten somewhere, they call me, I'm at the school, I'm somewhere else on campus, and I get there, everything looks fine. And within the joint, that means that it's no bones are dislocated or anything like that. So usually I just see swelling and things like that. But always ask if you feel like something moved and moved back. Subluxations can usually come back in on their own. That means that it was something that went out that was not supposed to go out, but enough force of you moving your leg or moving certain joints brought it back in. That also still means still go and get it checked out. If you like, okay, I really know something moved and came back in, you'll see usually significant swelling, it'll be weakness. Don't just say, oh, it's fine, I'm good, I'm gonna go back into the game. Wait. So that's sublux and that's dislocations. Dislocations, the biggest difference between them, they're both joint injuries. The difference is dislocations stay out. They don't move back. The force was enough to keep them out. You're going to see it. It's going to be there and different things like that. Like I said, find a healthcare professional, have them do it. If they are not qualified, don't have them do it. I personally be very, very careful. And if you do not trust that person, don't worry about their feelings, worry about your well-being, because if they mess it up, it won't, you have more complications. So if you don't trust them, just wait, get to a medical professional as soon as possible. You make sure your blood flow is not messed up. We want to make sure that nerves aren't getting entangled. We want to make sure everything's working the way it's supposed to. There's a lot that goes through joints, so please don't just say, oh, I'm okay. Subluxations, they're a little bit kind of harder to evaluate sometimes, especially as a athletic trainer, if you didn't ask the right questions. And sometimes athletes try to shake those off and keep going. Don't do that. Don't do that. Definitely make sure that it you get it checked out, looked at, make sure that, because that means that the joint is very, very weak. And also like to tell people, if you have multiple dislocations, multiple subluxations, get some rehab, go to a PT, find ways to get it to improve that joint stability, because a brace ain't gonna get it. It's just not. Okay. And the next thing I want to talk about are the most, this is the one that makes me create this video, is fractures. The most common thing is, oh, Miss Jordan, good news, I went to the doctor and they said it was fractured, not broken. Well, let me hold your hand while I tell you this. A fracture is a break. It's the medical terminology, but it means the same thing. It could be a partial break, it could be complete break. There are so many different breaks. If I believe correctly, I think it's 7 different types. So like you might have a small like hairline fracture, which means like it's a little crack in the bone. You can have a complete break that like there's so many different type of breaks. It can be a spiral break. So that just means that there is it could be a partial break or a full complete break to the bone. So that kind of also determines the return to play, is what we call it in athletics, time. So sometimes that might be of only like 3 weeks or 4 weeks. They're very, very, that's very like hairline fracture. Like it might not something crazy and it go all the way as it needs to. The thing is with fractures, usually when you see a return to play and you go to the doctor and ask how long is it going to take for this bone to heal, please remember that's how long the bone takes to heal. So if it's 4 weeks, if it's 5 weeks, it's 6 weeks, that's how long the bone takes to heal. After that, you still need to make sure that the muscles are strong enough to help, because like, I don't know if people have heard the saying, when you lose it, when you don't use it, you lose it. So the muscle's not being used because usually we're putting the break in some protective place. We're putting it in a cast. We're putting it in a place that it can't move. So the muscles aren't usually moving. They aren't moving. And you need to make sure that when you hear, oh, it's 4 weeks, you're not going to be back playing in 4 weeks. You need 4 weeks for the bone to heal, and then you need time for the muscle to get stronger and the confidence. Most people psychologically, they need a little bit more time, especially depending on how they got injured. So, those are the quick things I wanted to talk about today. So, we got to do a recap quickly. We got sprains with a P, which is a ligament, which a ligament is, say it with me. I don't want to sound like Dora, but you know what I'm saying. Say it with me. A ligament connects a bone to a bone. And a strain, which is a muscle injury. Both sprains and strains are categorized as 3 levels. So grade 1, pulled, not torn, stretched to its capacity. Grade 2, partial tear. Grade 3, complete rupture. Now we move on to dislocations and subluxations. Dislocations, a complete, the joint is not where it's supposed to be. You will see it. Anytime you see that, compare it to the other one, just to be on the safe side, or just like, ooh, it needs to be taken care of immediately. Don't wait. Urgent care, emergency room, just depending on what it is, figure out where you need to go. And also a sublux will pop out and pop back in place. Usually I commonly see this, I commonly see this in knees because sometimes the kneecap or the terminology of the bone is called a patella will move out. And if you straighten your knee, which is also called extension, it can go back in. So sometimes those people like to shake off and get it. Any type of injury to your joints, you want to make sure that number one, that there is no damage to the bone, and number two, you want to make sure that you get some stability. You want it to be strong. You want it to help. Joints are usually created for mobility, but we also don't want to forget about stability. And last but not least, fractures. Yes, Johnny, a fracture is a break. Yes, a break is a fracture. So when you come back, yes, they told you it was a fracture. So yes, it's a break. It could be a partial break, it could be a full break. And when you hear like, oh, it's going to take 4 to 6 weeks for this to heal, don't forget that you need to include the strength and different things that it takes after that, depending on where the injury is. Thank you guys for sticking with me on this. Hope you guys learned something. I would love to hear what you didn't know in the comments below. If you didn't know about something, or if you didn't know a little tip I gave you, please let me know. I would love to hear what you guys are learning. And if anybody wants to have a question about something they want to be defined on our next segment of Define This, I look forward to hearing from you guys. Love you guys. Look for another episode. Make sure that you are, if you want to watch it again, you didn't get it, it's fine. Take your time. You got it. Love you guys. God bless.